Hello everyone, here is another quick bug and drug STI presentation. So now we are going to talk about syphilis. And again, for my exam purposes, no, I'm super repetitive now. Know the bug, know the drug, know the first line treatment for an uncomplicated case of syphilis, which is kind of complicated anyways, but we'll get into it. A little bit of background here, probably some review from your ICM course. This is caused by Treponema pallidum is the bug. And then there are stages to the syphilis, and it will kind of depend on, that'll kind of vary, or rather that will, what I'm trying to say here? That will affect your treatment strategy. So you have your early syphilis, late syphilis, and neurosyphilis. So please look through those. And like I said, I believe this will be a review and kind of stuff you can given it in ICM. This is just FYI for my course. Just don't worry about that. First slide. Drug of choice is going to be your penicillin, specifically Pen-G, which we'll see on the next table, next slide. If they do have an allergy to penicillin, you can go with things like tetracycline, ceftriaxone, and azithromycin. However, out of those, azithromycin, there is issues now with macrolide resistance. So as a second line therapy, I would stay away from the azithromycin. So if the patient has a true allergy to penicillin, you can go with a tetracycline or the ceftriaxone. This is a great table here. Definitely want you guys to put a star by it as far as this column here. So you have early syphilis, late syphilis, and neurosyphilis. Preferred treatment here. Those are the ones that I want you guys to star and study. And then, like I said, if they have a true penicillin allergy. So go ahead and read through this table. And again, for testing purposes, definitely highlight this column here. Want to make sure you know. But it's pretty straightforward as far as if they don't have a penicillin allergy, you're going to do a Pen-G. So Pen-G, 2.4 million units, IM one time, and etc. But it's all penicillin G is going to be your first line for syphilis. So hopefully that'll help for study purposes. So for non-pregnant adults with early syphilis, and they do not have any evidence of the neurosyphilis, single dose Pen-G IM intramuscular, and that should do the trick for them. So shot of penicillin hopefully will do the trick. Again, if they are allergic, you can go to the doxycycline 14 days for 14 days. Again, for that early syphilis. So if a patient has tertiary syphilis or latent syphilis, without evidence of neurosyphilis, again, you can go with the Pen-G IM, and that is preferred over IV therapy. But then because it's this a little bit more severe than what we talked about before, this will be IM once a week for 3 weeks. Patient compliance can be an issue. Make sure they come back in the clinic, etc. Maybe they start feeling better after that first shot or whatever. So if the patient misses a dose and you have issues with compliance, if it's more than 14 days have elapsed, they do need to restart their course. So they will need to go back and get all 3 shots again. So hopefully you will stress the patient and hopefully they'll come back and make sure that they're getting their shots. Because hopefully they want a cure from the syphilis. Hopefully, I don't know. If they do have neurosyphilis, then you will go IV Pen-G, IV penicillin G rather than IM therapy. So this will probably be an inpatient setting. And this they'll be given 3 to 4 million units IV every 4 hours, or alternative 18 to 24 units with a continuous infusion. And this is going to be for up to 14 days. For patients with the late disease, they also generally administer a single dose of IM penicillin, the Pen-G, after the IV course has been completed, since the duration of the treatment for neurosyphilis is shorter than the regimen used for late syphilis. So then the patient should be monitored. This monitoring stuff you guys can just read through. It's just FYI for my course. Same thing here. Just go ahead and read through it. It's FYI. I won't be testing you guys over this stuff. Same thing here. Just FYI for my course. This as well. Yeah, just go ahead and read through this. It's just FYI. I'm not going to test you guys on that. So a person exposed sexually to a partner who has syphilis should be evaluated clinically and serologically to make sure they have an infection and then treat appropriately. And that is the end. So hopefully that was okay for you guys. Not too bad there. Main take-home point is going to be penicillin G, unless they're allergic. Then we have some alternatives there, like we mentioned, the doxycycline and the ceftriaxone. So anyways, short but sweet, like I said, bug and drug. Thank you guys for your time and attention, as always, and feel free to email me if you had any questions about this presentation, any comments, feedback, or any other stuff you want to share with me. I will talk to you guys later. Thanks again.